So parents ask me all the time, how do I know if my child's snoring is actually a problem? A recent study tried to answer that. Researchers looked at a large pediatric sleep database and compared common screening questions with overnight sleep studies and sleep apnea scores called AHI scores. Their goal was to find the questions that best predicted sleep disordered breathing in children. And a few symptoms consistently stood out. So first, regular snoring. Second, gasping, choking, or pausing in breathing during sleep. Third, mouth breathing or signs of airway obstruction at night. Researchers then compared these symptom combinations with actual sleep study results, and one of the most interesting findings was that certain combinations of just a few questions had extremely high predictive values. In fact, in the study, some of the three question combinations had a positive predictive value of 100% for severe obstructive sleep apnea when compared with the formal sleep studies. Now, that doesn't mean that these questions replace a sleep study, but it shows how powerful these symptoms can be in identifying kids who need further evaluation. And given how infrequently we order sleep studies in children, these questions are very essential. This is important because about 10% of children have habitual snoring or disrupted sleep. And untreated sleep disordered breathing can affect behavior, attention, school performance, overall health, and even brain development. So the takeaway for parents is simple. If your child snores regularly, breathes through their mouth, or has pauses in breathing at night, it's worth having that evaluated. Sometimes the right questions can reveal a much bigger issue. I'm Dr. Morgan Yost, helping families understand the research behind pediatric sleep and airway health.